I owe you an apology. For years, every time someone asked me why their forehead was getting heavier, why their brow was sinking, why those horizontal lines were getting deeper, no matter what cream they used, I gave them the standard answer. I talked about collagen. I talked about elastin. I talked about sun damage and gravity and time. And I wasn't wrong, exactly, but I was incomplete. I was missing something. And what I was missing changes everything about how you think about your forehead, your brow, and whether you actually need a surgeon to fix what's happening up there. Because there's a structure sitting right now between your skull and your forehead skin. It's not a muscle, it's not skin, it's a fibrous sheet about the thickness of a credit card, and it runs from your eyebrows all the way back to the base of your skull. It's called the Galea Aponeurotica. And I guarantee your dermatologist hasn't mentioned it. Your esthetician doesn't know it's there. Even most cosmetic surgeons who operate on it every single day don't explain it to their patients. But this sheet, this Galea, is the reason your forehead looks the way it does right now. And the fact that nobody's talking about it is honestly the reason I'm making this video today. So here's what I want to walk you through. There are 5 things happening to your forehead right now. 5 visible signs that something is going wrong underneath. And they look like 5 separate problems. You might be treating them as 5 separate problems, but they're not. They share a single root. And when you understand that root, you'll understand why a 45-second technique done with nothing but your own hands can address what most people think requires a surgical lift. Let's start at the surface and work our way down. The first thing you notice, the thing that probably bothers you most when you look in the mirror, is the lines. Those horizontal creases running across your forehead. You've tried creams, maybe retinol, maybe peptides. Maybe you've even had Botox injected into your frontalis, which is the broad, flat muscle that covers your forehead. And here's what happened. The Botox smoothed the lines, but your brow got heavier. Your eyelids felt like they were sitting lower. You traded lines for heaviness because the Botox stopped your frontalis from contracting. And your frontalis was the only thing holding your brow up. But why was your frontalis working so hard in the first place? Why is that muscle gripping and contracting all day long, creating those lines? That's the question nobody asks. And the answer isn't what you think. If you've been following along and you're already thinking about your own forehead right now, that tells me you're the kind of person who actually wants to understand what's happening underneath, not just cover it up. Drop the word Galea in the comments so I can see who's paying attention. Because what comes next is where this gets really interesting. Now let's go deeper. The second thing that happens, and you may have noticed this over the past 5 or 10 years, is that your brow line drops. Not dramatically, not overnight, but gradually. You look at photos from 10 years ago and your eyes looked more open. Your brow sat higher. Your entire upper face had a different architecture. And you assumed that was skin laxity, loose skin, gravity pulling everything down. That's the obvious explanation, but it's only half the story. Your brow position isn't determined by your skin. It's determined by what your skin is attached to. And your forehead skin isn't floating freely over your skull. It's anchored. It's tethered to deeper layers through connective tissue. And the most important of those layers is the Galea. Think of it this way. Imagine you're stretching a piece of cling film over a bowl in your kitchen. When the cling film is taut, the surface is smooth. Everything sits where it should. The edges grip. Now imagine that cling film has been sitting there for 20 years. It hasn't torn. It hasn't disappeared, but it's lost its tension. It's gone slack. It sags into the bowl, the surface wrinkles, the edges droop. That's your Galea. The bowl is your skull. The cling film is the fibrous sheet that's supposed to hold your forehead skin in position. And after decades of zero mechanical stimulation, it's gone slack. Not damaged, not diseased, slack. And that slack changes everything above it. Because your frontalis muscle, the one that makes those horizontal lines, doesn't attach to your skull directly. It attaches to the Galea. So when the Galea is taut, your frontalis has something to pull against. It can lift your brow efficiently with minimal effort, the way it did when you were 30. But when the Galea goes slack, your frontalis is pulling against nothing. It's like trying to lift a tent by pulling on a rope that isn't anchored. You can pull as hard as you want. The tent sags. So your frontalis compensates. It contracts harder. It grips longer. It works overtime just to hold your brow in a position that used to be effortless. In those horizontal lines you see, they're not the problem. They're the evidence of the problem. They're the footprint of a muscle that's exhausted because the structure underneath it stopped doing its job. If the connection between the galea and your frontalis just clicked for you, this is a good moment to hit that like button. You've just passed the halfway point of the mechanism, and the part that comes next, the part about your scalp, is what pulls the whole picture together. Now here's where it gets uncomfortable. Level 3. Put your hand on top of your head right now. I'm serious. Put your fingers on your scalp, right at the crown. Now try to move the skin. Try to slide it forward and backward. Can you feel it move? How much does it glide? A centimeter? Less? Because here's the test. If your scalp barely moves, if it feels stuck, locked, almost glued to your skull, that's not normal tension. That's fascial adhesion. Your galea has become so stiff in some areas and so slack in others that it's lost its ability to glide. And that matters for a reason most people would never connect. Think about a drum skin. When you stretch a drum skin properly, tight and even across the frame, you get a clean sound, a resonant tone. The whole surface vibrates in harmony because the tension is distributed equally. Now imagine that drum skin is loose on one side and stuck on the other. You strike it and you get a dull thud. No resonance, no vibration spreading across the surface. The stuck side can't move. The loose side flops. The instrument is broken, not because the skin tore, but because the tension became uneven. That's your galea right now. Some areas are adhered to the periosteum, the membrane covering your skull. Other areas have gone slack and separated. And your frontalis muscle, sitting on top of all this, is trying to play a clean note on a broken drum. It can't. So it compensates with brute force, and your forehead shows every bit of that effort. You're now 3 levels deep. You've seen how the lines, the brow drop, and the scalp tightness all connect, but we haven't reached the root yet. 2 more levels, and the one at the bottom is the one that changes what you do about all of this. Level 4 goes even deeper. The galea isn't just a passive sheet sitting there. It's a living connective tissue structure. It has blood supply, it has nerve innervation, and like every connective tissue in your body, it responds to mechanical load. When you load it, when you apply pressure and movement, the fibroblasts inside it produce collagen and maintain the structural integrity of the sheet. But when you don't load it, when that tissue sits in the same position, under the same minimal stress, day after day, year after year, the fibroblasts slow down. They receive no signal to maintain the architecture, and the tissue gradually loses its tensile strength. Not because you're aging, because you're not loading it. Your galea was designed for a life with far more scalp movement than you give it. Chewing tough foods for hours engage the temporalis muscle, which connects directly to the galea's lateral edges. Carrying loads on the head activated the entire galeal sheet as a force distribution platform. Even vigorous physical activity created rhythmic blood flow and mechanical oscillation through the scalp. Modern life eliminated all of that. Your galea sits in a mechanically silent environment 16 hours a day. In tissue that receives no mechanical signal, interprets that silence as permission to stop maintaining itself. That's the root. Level 1, galeal slack caused by mechanical neglect. Not aging, not genetics, mechanical neglect. And every symptom above it, the scalp adhesion, the frontalis strain, the brow drop, the forehead lines, every single one is a downstream consequence of this one structural failure. Now here's the part that should make you feel something. Because this is the same structure, the exact same anatomical layer that a cosmetic surgeon cuts and retensions during a forehead lift. The surgical procedure works precisely because it addresses the galea, The surgeon makes an incision, separates the galea from the periosteum, pulls it taut, and reattaches it. That's the operation. That's what a forehead lift actually is. It's a galeal retensioning. And it works because the galea is where the problem lives. So the question becomes very simple. If the galea responds to mechanical tension, and if surgery works by restoring mechanical tension to the galea, can you create that mechanical input without a scalpel? And the answer, based on how connective tissue physiology actually works, is yes. Not with a cream, not with a device, with a specific kind of manual pressure applied to the right zones in the right direction for the right duration. If someone you care about has been considering cosmetic procedures for their forehead, this would be a good moment to share this video with them. Not because surgery is wrong, but because they deserve to understand the mechanism before they make that decision. Here's the technique, and I want you to do this with me right now, not later, not tomorrow, right now, because it takes 45 seconds and you'll feel exactly what I'm talking about. We're going to press 3 zones. Each zone sits directly over a region of the galea. Each press lasts 15 seconds. The pressure isn't gentle and it isn't painful. It's firm. Think about the pressure you'd use to knead bread dough. Not touching the surface, not crushing it, loading it. Zone 1. Place the heels of both palms at your hairline, right where your forehead meets your scalp. Fingers pointing backward over the top of your head. Now press inward and slightly upward. You're compressing the galea against your skull. Don't slide your hands, don't rub. Press and hold. Feel the resistance under your skin. That's the galea. That sheet of tissue is directly under your fingers right now. Hold that pressure for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Good. Release slowly. Zone 2. Move your hands to your temples. Place your fingertips just above your ears in that soft zone where you can feel the temporal fascia. This area connects to the lateral edges of the galea. Press inward toward the center of your skull. Same pressure. Same firm, steady compression. Hold for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Release. Zone 3. Bring both hands to the crown of your head. Fingertips interlaced, palms pressing down onto the top of your skull. This is where the galea is widest and often most adhered. Press firmly downward. You might feel that this area is tender or stiff. That's the adhesion talking. Hold for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Release. That's 45 seconds, 3 zones. Done. Now let's talk about what just happened, because you might be thinking this is too simple. 45 seconds of pressing can't possibly make a structural difference. And if you did it once, you'd be right. One session changes nothing permanently. But connective tissue doesn't work on a single session model. Connective tissue remodels in response to consistent, repeated mechanical input over weeks and months. Every time you apply that press, you're sending a mechanical signal to the fibroblasts in your galea, you're telling them the tissue is being loaded. And fibroblasts respond to load the way muscle cells respond to exercise. They increase collagen synthesis. They reorganize fiber architecture. They restore tensile integrity. The timeline isn't instant. Fascia remodels slowly. You're looking at 2 to 3 weeks before the tissue begins responding measurably, 6 to 8 weeks before you notice changes in scalp mobility, in 3 to 4 months before the downstream effects, the brow position, the line depth, the forehead heaviness begin to shift. This isn't the quick fix, but it's also not a 90-minute surgery with 6 weeks of recovery and $15,000 on the table. And here's a second objection I know you're thinking. Isn't this just a scalp massage? No, and the distinction matters. A scalp massage moves the skin over the galea. It increases blood flow to the surface. It feels good, but it doesn't load the galea itself. The scalp press compresses the galea against the skull, creating transmural pressure through the full thickness of the tissue. That's a fundamentally different mechanical signal. Massage says relax. Compression says rebuild. Your fibroblasts know the difference. Do this every morning, 45 seconds, after you wash your face, before you leave the bathroom. Let it become as automatic as brushing your teeth. The galea doesn't need an hour of your time. It needs 15 seconds of real pressure in 3 specific zones, consistently, day after day. Remember that cling film stretched over a bowl? The galea that went slack after years of neglect? Imagine pressing that cling film back against the bowl every day, gently but firmly, re-establishing contact between the film and the surface. Over time, the film doesn't just sit better, it re-adheres, it grips again. It holds the shape of the bowl. That's the remodeling process you're initiating. And remember the drum skin that lost its even tension, that gave you a dull thud instead of a resonant tone. Each time you press those 3 zones, you're redistributing tension across the galea. You're breaking up the adhesions on one side and restoring tone to the slack areas on the other. Day by day, press by press, the drum begins to resonate again. The frontalis no longer has to grip against nothing. It has a taut surface underneath it. And when the muscle can work efficiently, it stops over-contracting. The lines soften, not because you paralyzed the muscle, but because you gave it a proper foundation to work on. So let's reconstruct what you understood about your forehead before this video and what you understand now. Before, you thought forehead aging was about skin, collagen loss, sun damage, gravity pulling everything down. You thought the options were creams that promise more than they deliver, Botox that trades lines for heaviness, or surgery that costs a fortune and carries real risk. Now you know there's an architectural layer between your skin and your skull called the Galea Aponeurotica. You know it functions as a tension suspension system for your entire forehead. You know it's gone slack because modern life provides 0 mechanical stimulation to it. You know that galeal slack is the single root cause behind your forehead lines, your brow drop, your frontalis strain, your scalp adhesion, and the overall heaviness of your upper face. You know that cosmetic surgeons fix this by mechanically retensioning the galea. And you know that you can begin that same retensioning process yourself with 45 seconds of targeted compression, 3 zones, every single morning. That's not a small shift in understanding. That's a completely different framework. You walked into this video thinking about your skin. You're walking out thinking about a fascial layer that controls the mechanical architecture of your forehead. And once you understand that layer, once you felt it under your own fingers, you can't go back to thinking creams are the answer. You can't unknow the galea. It's there, it's real, and every morning for the rest of your life, you have 45 seconds to talk to it. If this changed how you think about your face, hitting subscribe means you won't miss the next time I find a mechanism hiding in plain sight. I'll see you there.